Good evening. I'm here today again. I want to talk about hepatitis, the management and prevention. But before I go further, please kindly like, share, and follow my page. And you can get in touch with me on YouTube on through Oluwakemi Bitoye, and you can get to me again on Instagram through Oluwakemi Bitoye. So hepatitis is inflammation of the liver. It's a disease that affects the liver. It's an inflammatory disease of the liver, which is caused by virus and other means too. But the main cause is virus. The other means that can cause hepatitis is alcohol, antioxidant, and autoimmune system disorder. And it has types. It has 5 types of hepatitis. We have hepatitis A, B, C, D, and E. And the route in which each one can be gotten is through, like hepatitis A is through fecal oral, as in is maybe through is through contaminated food and water. The virus is gotten through contaminated food and water. Maybe somebody that is already infected and use the source of water and contaminate it. Another person that is not infected take it or use it to prepare food or take it in. The person may become infected. So that is why they call it fecal oral, as in from anus to the mouth. So the hepatitis B is through blood contact, as in maybe sexual intercourse, through sexual intercourse, through on-screen blood, or coming in contact with substance or body fluid that is infected. The person can be infected through that means too. And again, hepatitis C, the same thing too, through blood contact. Hepatitis D too, through blood contact, while hepatitis E is through contaminated food and water. So, and this virus, this hepatitis, each type is the virus that causes it is different. It's not one particular virus that causes all this type of hepatitis. Is different type of virus. And again, the other types like that types of hepatitis that is not a result of a viral infection cause is alcohol. Alcohol can cause it, can affect the liver, and autoimmune system disorder can cause it, and other toxins can cause it. And what are the signs and symptoms of hepatitis? Hepatitis, we have there is sometimes some of this, like the chronic B and C, they don't usually bring the people that have it doesn't show symptoms. Is when the liver is damaged that you see them coming down with symptoms. So but the other type, the type of the signs and symptoms you can see in this type of people is that you see some of them, they will be fatigue, there will be flu-like symptoms, there will be loss of appetite, there will be abdominal pain, there will be unexpected weight loss, and there is a yellow discoloration of the skin and the eye, and there is pale stool, there is dark colored urine, and what are the diagnosis? What can be done to be able to know that this person has this to be able, apart from all these signs and symptoms I've named, that to be able to diagnose that this person has hepatitis, any type of hepatitis, is that through physical through history taking, through physical examination, through liver functioning test. Your consultant may request for further stuff like liver functioning test by liver biopsy, ultrascan, and others. And the treatment, actually the treatment for hepatitis, the hepatitis A is a short-term illness. It doesn't stay long, and it doesn't really need treatment. But if it's bringing serious discomfort to the individual, the consultant may request for bed rest, and if there is vomiting and diarrhea, they may look towards dietary approach by ensuring that the client is kept in place by good hydration and to maintain adequate nutrition in that client. So, and after the other ones, like the hepatitis B and C, the chronic B and C, antiviral medication can be used, depends on the consultant. And other measures that can be put in place is that the patient, the client is ensured that they should rest well and they should eat adequate diet. So the prevention of hepatitis is that we should try to live a positive life, a healthy life. By one, you should try to minimize your contact with things that can make you to be infected, as in you should not share razor, needle, or use another person toothbrush, or you should avoid anything that can make you to be exposed. And again, you should try to eat well and ensure a very good source of water, since the other causes apart from through blood contact, they say you can be infected through due to bad water or food. So you should try to ensure that you get a good source of water, and again, you should try to live positively. I don't mind saying what do I mean by living positively, as ensuring a safe life practice, as in a safe practice. You should try to abstain if you are the type that is not ready, but if you are going to indulge into it, you should try to be with one uninfected partner. And if the person you are with, you don't trust the person, use barrier method like using of condom and dental dam for people that are engaging in oral sex. And again, you should engage in regular oral screening and regular medical screening. Regular medical screening for proper checkup, and again to know your status. And again, you should try to eat well, exercise the way you can, and live a positive life. And again, you should get vaccinated, as in the hepatitis A and B has vaccine. But a B vaccine can protect someone against hepatitis D, but hepatitis C and E, up till now, there is no vaccine for them yet. So we should try to live positively and to enhance a healthy life. And the conclusion, what is before I go for to the conclusion, the complication of hepatitis is that it can cause liver damage or liver failure if proper care is not instituted, and if adequate measures is not put in place. It can even lead to death. So the conclusion is that hepatitis is of 5 types: A, B, C, and E. And the route it can be contacted is either from contaminated food or water, or from through blood contact. And it is a disease that affects the liver, that make the liver to become inflamed, and it can impair liver function. And for us to be able to prevent this type of condition is, one, you should get vaccinated. You should go for your vaccine for the ones that have vaccine. And two, again, you should live a positive life. You should try to minimize yourself from getting infected. Don't share razor, don't share needle, don't use toothbrush with another person. And you should try to practice a safe sex, as in use condom correctly and consistently if you're going to use it. If you are not sure of your partner, you should use condom. And again, you should try to eat well, and again, ensure a very good source of water. where you get your water, your drinking water, ensure a very good source of water, and try to live a positive life and a healthy life. At this point, I'm going to bring the talk to an end. Please don't forget, kindly like, share, and follow my page. You can get in touch with me on YouTube, on through Ibitoye through Oluwakemi Ibitoye, and on Instagram too, Oluwakemi Ibitoye. Thank you very much. Have a very good night rest.